In the drive to create strategies that improve public health, practitioners can find themselves implementing schemes but not fully evaluating whether they actually work. King's College London is plugging this gap by linking academic research with services being delivered. Their Urban Public Health Collaborative in South East London is assessing the NHS health checks available to everyone aged 40 to 74. Our reporter went to Lewisham to find out more.
Okay, welcome Sonya. My name is Neil. I'm one of the pharmacists here. We'll be doing an NHS health check on you today.
45-year-old Sonya Brennan has recently lost 5 stone and turned her life around after a worrying NHS health check.
We do a number of tests. So we measure their height, their weight, their bodily mass index. We take a small blood sample where we measure their cholesterol and, if required, their blood sugar levels. We ask them questions about their diet and exercise, whether they smoke or not, and their alcohol consumption. We then decipher a score, and what that score is the risk of developing cardiovascular disease.
Sonya now leads Nordic walking classes for the community.
When I first started walking, I have quite a bit of a hill up my road to get to the park. It took me, used to take me 5 times just to stop, really get my breath back and then walk again. And really now I walk up it without a problem.
The pharmacy where she had her test is in New Cross in South East London in the Borough of Lewisham. Take-up for these tests is low. An urban health collaborative is looking at why. The London boroughs of Southwark, Lambeth and Lewisham have areas of high economic deprivation and also large ethnic minority communities and the health issues that these 2 factors are associated with. The ultimate aim of the Urban Health Collaborative is to improve health outcomes for these people. Nearby, the board of the collaborative is meeting. It includes 3 hospital trusts: Guy's and St Thomas's, King's College Hospital and the South London and Maudsley, plus King's College London University.
We are now working with Jill and John to develop the King's Health Partner concept of an institute.
Its full title is King's Health Partners, and it's now looking at creating an institute of urban population, health and care, which will spread best practice.
Essentially, it was about what are the priorities in public health we needed to deal with? How would we develop and design really innovative ways of doing that? And then how would we develop capacity in the workforce? It was around collaboration and a change of culture.
The reason that you need a collaborative of everybody, so this is a pretty complex collaborative coming into this institute, is that obviously it's helpful to have all the dimensions of King's College London, because there's many different sciences that can contribute to the health of the people, statistics, for example, as well as strict public health. But then, if we're going to achieve anything, we have to work with all our partners, not just in the hospital care, but out in the community.
Certainly in population health, working with local authorities, the Health and Wellbeing Board is the only way to reach those communities and families that we need to. We know that people don't change their behaviour very quickly or very easily, and this collaborative is about ensuring that we reach those families more quickly. Our goal is to translate science more quickly into the community.
And back to those NHS health checks. The collaborative is already identifying why many people aren't turning up.
Some of the themes that have emerged as to why they attend or why they don't attend relate to how well it's publicised. So that's been one of the issues. One of the other issues is their own understanding of how susceptible they are to heart disease or stroke. It's very important that what we are implementing at a local level is evaluated so that we know that we're doing the right thing.
The real positive factor of working collaboratively has been the link between public health professionals on the ground with the academics from King's College to work together to plan different trials, to look at the programmes. So we've looked at a number of different things. We've looked at the uptake, and we've also done a number of patient interview studies and asking people what stopped them coming from a health check.
The collaborative has already identified some approaches that work on obesity, retinal screening for diabetes and having conversations much earlier about alcohol. And it'll soon report on how to improve uptake of NHS health checks and their effectiveness.